this place called community, we raise our families, we invest our education, our hopes and dreams, and we want for every child the very best. It is in this unique place we call community, faces of children come in a variety of color and backgrounds, but still have similar needs. Here in this place called community, we support each other, work together, worship together, and sacrifice to meet the needs of those in need. For so many, Omaha, Nebraska is this place we call home. For thousands of men, women, and children, Charles Drew Health Center is their medical home of choice. Charles Drew offers families of all racial, ethnic, and financial backgrounds affordable health care that is second to none. Since 1983, Charles Drew Health Center has served as a constant in the North Omaha community. The health center has served as a safety net for families living without the benefit of health insurance.
Charles Drew services, Charles Drew is like wraparound. I have a 19-year-old who aged out of foster care, who needed medical services just like a month ago. Charles Drew houses the Fast Forward program, and he was a client of that. Charles Drew WIC program, the dentist, the doctors, the pharmacy, Dr. Ochuba's been there forever. It's like it's a big complete family, but you're still getting the services that you needed.
The first time that I came here for a week, enrolled for a week, and then they invited me to enroll to the Omaha Healthy Start, and I have a case manager to visit me every month because last time I was have a first pregnant and I'm really sick, and that's good because I have a nurse come visit me and take care of me.
How did I learn about Charles Drew and Fathers for a Lifetime? I heard about it on the radio. It sounded like a great program, and I needed to really grasp onto that fresh start and get some knowledge about the importance of being a dad. They really helped me out to support me and to motivate me when I feel like quitting, basically, and giving up. And so that's important to me because in return helps my kids, which is the whole reason I went to Fathers for a Lifetime in the first place.
I had a problem with my back, and it's been a good experience. Well, it's been very convenient. It's easy the appointments are easy with the two offices. If I can't make it to one office, I can make it to the other. And like I said, the convenience. I can get off of work, be there in 5 minutes, get back to work. From the front desk to the assistants to the physicians, it's been a very, very good experience.
Hundreds of competent professionals have chosen to serve the community by becoming part of Charles Drew Health Center's healthcare delivery system. As one of the largest minority employers in North Omaha, Charles Drew Health Center gets it. Led by a diverse group of men and women who volunteer to serve on the governing and foundation boards, CDHC has as its mission to provide quality, cost-effective patient care that acknowledges the value of community and patient involvement and honors the role that families and community play in improving the health status of all Omahans. Like our patients, Charles Drew Health Center's medical and dental providers, support staff, and administrators represent the best that Omaha has to offer. Our board-certified medical and dental providers all have made conscious decisions to serve Omaha's most vulnerable population with dignity and respect.
I decided to come to Charles Drew because I felt that I can make a difference in the lives of patients we serve here. We see patients from diverse ethnic backgrounds, and patient population do have a lot of chronic illnesses such as diabetes, asthma, and hypertension. I felt that with my knowledge and education that I can make a difference in the lives of our patients.
I choose to work at Charles Drew because I truly love going home every night, knowing that I've help people that maybe wouldn't be served other places, people that wouldn't have access to care. It just really gives me gratification knowing that I'm helping other people, and that's why I've continued to work here as long as I have.
We're able to offer primary care services from all aspects, from 0 to 100. And that's primarily what we do as family practice doctors. But the unique thing, as we all know, Charles Drew is able to offer that service to people whether they have insurance or whether they don't. My community is one that probably has the smallest voice. For multiple reasons. There's multiple reasons for that. However, me wanting to come back and work at Charles Drew, I felt like I'm a huge advocate. I'm just one of those people. I'm not a real small, timid person. I'm kind of big personality and a big mouth to go along with it. Being a sort of a strong and forceful personality, I'm able to advocate for my patients. And who better to need that advocacy other than my own community?
I chose to come to Charles Drew because basically wanted to give back to the community. I'm from the community. I went to school in the community. It was a need in the community. And I also wanted to show everyone that as a black man that you can become a doctor, and hopefully that inspires other youth to want to actually serve in the community and help their community out as well.
Charles Drew Health Center patients are as diverse as our community. They represent the best of Omaha, and yet, for many, their plight also reminds us that eliminating health disparities, improving maternal and child health outcomes must continue. Our administrative team and volunteer board members, many of whom are users of the health center, are equally as committed to using their skills and talents to ensure that Charles Drew Health Center continues to operate efficiently and continually striving for excellence.
Well, it gives me a great deal of pride to be associated with an organization that's involved with providing patient care to individuals. It's been my life's work to ensure that health care is provided to those who don't necessarily have the opportunity to get it provided from somewhere else. My first experiences were with community health centers were as a patient. Growing up, we didn't have a lot of money, and so for dental care and for primary care services, we went to the community health center. And since a child, I've been very grateful for the work that they did, and I'm just very, very proud to be a part of the community health center now and to lead as we go forward into the future.
Well, I choose to serve Charles Drew because I've always believed that if you receive a blessing, you're required to share that blessing. Plus, when I was growing up, I was in a position of growing up without health care. So I know the strain that it puts on a family, particularly a single mother, in trying to provide health care to children.
Our community is characterized locally and nationally for its unprecedented history of generosity. Since 2001, Omaha's philanthropic community has increased its support of Charles Drew Health Center tenfold. Local foundations, corporations, businesses, both large and small, and concerned individuals have impacted Charles Drew's mission to expand its programs and services. The $4 million raised to complete the health center's 13,000 square foot expansion in 2007. The increased giving to the CDHC annual sustaining campaign since 2008. The addition of a fitness center, cooking classes, and disability support services for adults. Expanded medical services like podiatry, cardiology, behavioral health, and senior services. The opening of 3 school-based health centers serving 69 host and linked schools, 2 EduCare centers, and 8 early childhood care centers. Expanded on-site and in-home interpreter services. And many other programs and services have all helped to increase the number of patients each year. Charles Drew Health Center is proud to call caring organizations like Allegiant Health, Building Bright Futures, Creighton University Medical Center, the Enrichment Foundation, Logier Foundation, the William and Ruth Scott Family Foundation, the Robin Hill Charitable Foundation, the Nebraska Children and Families Foundation, Union Pacific Railroad, and many others, partners and friends.
Charles Drew and Allegiant Health really have a rich history of working together and with other collaborations to serve our community. And what I love about Charles Drew, part of what it means to be in community and serving community is to show up and be engaged. And Charles Drew is one of our federally qualified health clinics, has always been there. When we receive monies from folks, we are always accountable to achieve the outcomes that we've said we will do. So there's an outcomes expectation to improve the health status of our community. That's kind of the what. Another important dimension is the how we are to one another to get there. And that's where what's so important is that we're engaging with folks, we're listening to folks, we're humble, we're compassionate, and we are in community in a spirit of respect and mutuality.
We expect that money is going to help people lift themselves up and make changes in people's lives. So Charles Drew really feels the need, and my hope is that this organization will continue to flourish and serve people who have a right to good health.
The work of Charles Drew is a great achievement, and I hope that we can expand it in the future, because people that live in that area do not have decent health care. Those are the things that I want to do something about.
If you're a banker and you invest in a company, either through a contribution to that company or by making a loan to that company, what you hope for, what you want, is for that company to prosper, to be larger than they were a year before, to be healthier than they were a year before, financially and other ways, and to come back and do it again and again and again, and the whole community prospers.
These organizations and individuals give generously to help hardworking families strive to be more than just self-sufficient. They give with the hopes that their gifts change the community, one family at a time. And in doing so, the individuals and families that benefit from these community-based services are compelled to give back to the community that they call home.
Charles Drew is an organization right in North Omaha, and it has a lot of successful people that look just like me. It's not out of my reach to become an executive director or a program manager or to work at the WIC office or to be a doctor or a dentist. It's not out of our reach, and the environment there is family friendly, so it showed me that if I just apply myself, that I could be exactly what they are.
Right now, I made the decision to go back to school. I'm going to UNO right now, and I'm in my second semester for my bachelor's degree. And I want to do social work, and hopefully I'll have the opportunity to give back to the dads that are out there struggling and help them.
After delivery, the nurse visited me. She told me that because she wanted me to have a job, so I said, oh yes, I would like to be interpreter. And so is it okay if I apply for interpreter at a Children's Health Center? And then I applied.
Our commitment to improving the health and well-being of the entire community guides our daily decisions on how best to meet the needs of our patients.
Charles Drew is unique in that they really are the community health center for North Omaha. They have the potential to make a dramatic difference in a community that needs or can appreciate that kind of help.
You don't have to be a multi-millionaire to give of your resources. You can write a $10 check, you can write a $25 check, and that is meaningful to the organization. In fact, healthy organizations are getting hundreds of $25 checks to help them function in a healthy way.
If you add up the benefits of changing this equation of tremendous poverty and what it leads to, and compare that against the cost of really doing something about it, you can't help but be appalled. And Charles Drew is one of the factors in that entire equation, and people should support it.
Omaha's culture of service, supported by its spirit of giving, can be seen and felt in all parts of metropolitan Omaha, in the lives of single-parent families, working families, immigrant families, homeless individuals, grandparents raising grandchildren, foster care parents, and the list goes on and on.